we have with us again Dr. Alice Emery. This is her second lecture of the year, did methadone earlier about a month ago and is back to share more about mindfulness. So welcome, Alice. I'm going to hand it over to you. I'm going to get rid of this bar up here and you should be good to go.
Okay. Hi, I'm Alice Emery. I work with Hospice of Holland and Keystone Palliative Care in Holland and Grand Rapids. Oh, you're zooming in.
We'll see you.
Okay. Okay. And they asked me to do this mindfulness lecture a few years back, and it stems from my interest in resilience and promoting resilience in the fellows and the residents that we work with and in everyone. And I started doing meditation. And so I felt like that was a really useful thing. And I started talking about it. And then this lecture sort of grew into not just to talk about meditation, but other techniques and other ways of increasing resilience and happiness. And I've been reading about this topic and studying it, but I started doing meditation probably about 15 years ago now, and I do find it very helpful. So just gonna see what we can come up with talking about mindfulness and the science of happiness. Now, my slide's a little scrambly there, but it basically starts out saying that I'm not even sure this is a normal medical topic, because normally we don't talk about how to regulate your own internal world, how to regulate your emotions, how to deal with stress. And I know as we go through college and medical school and residency, we've already learned techniques to deal with stress, and we've already learned how to keep ourselves on task and how to keep pushing through difficult times. But some of us are doing better than others with that, and there is a lot of burnout. And I'd like to help all of us do better with managing stress and being more happy in our personal lives as well as in our work. So the why is that, and the how is techniques and changes that we can make in our lives if we could figure out how to change things in our lives. Let's see if I've got a why slide. So I think everybody is starting to realize that there's an epidemic of anxiety and depression in America. And it used to be that old men were the most depressed people. When I was in med school, they taught us that old men are the ones who commit suicide because they're depressed. But now we see that young people are as depressed or anxious as any other group. And that's been a big increase, I believe, since about 2010, when the smartphones really rolled out to the teenagers and things. Everybody started doing their social life differently, and the changes that have happened have not been positive for mental health. So I think we need to talk about ways to improve mental health because of that. Also, I think it's our business to help our patients be happy, not just have physical health and get their potassium in the right box, but to come up with ways to help people other than pills, if possible. I think it's part of being healthy, being healthy and happy go together. And it's important for us to take care of ourselves. We have to be functioning well to be good at what we do. And maybe internal medicine or surgeons, they could keep rolling and it wouldn't make that much difference how they're feeling inside. But with palliative medicine, everything we do is state dependent. You don't even realize that it's state dependent. Like if you're floating around happy, you're going to have a completely different impact on other people than if you're under a black cloud and tense and upset. So as we go from one patient room to another patient room to another patient room, we're dealing with a lot of emotions, a lot of people who are struggling, a lot of patients and families who are struggling, and even sometimes the staff at the hospital are struggling because they can't get what they want from the patient or the family. And so if we are in a good place and we're able to be the calm in the storm and buffer everybody. It really helps a lot. So we need to function well to be good as palliative care physicians, I think. I wanted to tell a story about a grand rounds I went to. I used to go to internal medicine grand rounds all the time, but I went to an internal medicine grand rounds a few years ago when it was a palliative care physician giving the talk. And he mentioned that before he goes into the patient's room, he always stops and takes a couple deep breaths to center himself. And I thought, boy, that's a funny thing to say at grand rounds. At grand rounds, it's usually very academic. They don't talk about the internal experience of being a doctor. But I felt like, a palliative care physician could say that because there's a lot more of a focus on the psychology and the emotional health in palliative care. And I really like that. So let's talk a little bit about what we know so far about the determinants of happiness. A lot of people believe that your happiness level is going to be related mostly to what's going on in your life. Like when people hear that I'm a palliative care or hospice physician, they assume that all my patients are really sad all the time and that everybody's sad because they're dying. But actually, I don't think that uncontrollable life situations color your emotions all that much in the long run. In the short term, they certainly do, but they say it's only about 10% that's related to the situation that you're in, and there are genetic factors, and then there's a big chunk that's controllable by the individual, meaning that there are just individual ways of managing your emotions and your happiness. Dr. Raffo was here last year when I did this talk. I heard you I heard you saying something in the lecture last year. So you can
Yes, and I'm happy to report, this year, my stress level was 11 and now it's like 4.
Wow.
Well, there you go.
Yeah. Palliative medicine's good for you. All right, so hopefully we're all learning to reduce our stress levels, and that's kind of one of the biggest tasks that we have in this modern job and modern life is to control our stress levels. Okay, so what's it like to be happy? We've got the short-term elation, joy, and then we've got the long-term contentment. So like short-acting morphine and long-acting morphine, we've got the right this minute happiness, like when you pass the boards, that makes you just smile ear to ear for 4 hours. But then there's the long-term, day-by-day contentment. So Aristotle came up with these saying that hedonic momentary happiness is sort of a vulgar kind of happiness because it can come from the body or it can be just short-lived. And then there's the longer term happiness, the eudaimonic flourishing, that comes from purpose, growth, self-acceptance, working towards mastery and autonomy and a positive connection to others. So that was Aristotle's way of saying that the short-acting happiness isn't really the one we're going for. It's the underlying or long-acting happiness that is the most impactful. And I was thinking on the way when I was driving here, before I started meditating, many years of adulthood, I would hear people say this phrase, the joy of being alive, just the joy of being alive. And it never meant anything to me because I didn't understand what they were talking about because I didn't have that joy of being alive. But after I started meditating, I started to feel that, which is just like when I'm just going along, say, driving my car, just feel that joy of being alive. And I feel like that was something that was covered over in my internal life by anxiety or trauma or things I was thinking about, or all kinds of things that got kind of cleared away with using meditation as a practice, and that made that available to me, that happiness that's underlying. So I didn't really realize that there was a positive feeling underlying just being alive if you could clear all the junk out of the way. So I feel like that's something that just comes with life. So we want to be happy ourselves, and we want our patients, even and our children, to live their best lives and be happy. So how do we prescribe happiness? How do we increase the happiness of people around us? We know that lifestyle factors promote health and happiness. For example, a health promoting diet. In prisons, they have done studies because prisoners' food is sometimes like worth $2 a day when really it should be more like $6 or $7 to create a really healthful diet for them. They tend to eat a lot of processed foods. And when they have done studies, they've done a variety of studies on improving prisoners' food, and it decreases their violence by quite a lot. To make it randomized, double blind, they had to do it with supplements. When they did it with real food, it worked just a little bit better, but it's around a 37 to 40% improvement just by improving their nutrition. And so it decreases attacks, prisoners' attacks on each other, on guards, suicide attempts, and just general violence. So a health promoting diet is actually good for you mentally and physically. And when I ask people, I usually ask people when I'm doing an admission for palliative care, what do you eat? Just one sentence, what do you eat? And they usually say, oh, we eat healthy. And then I say, well, what do you mean? What do you mean by that? Well, we eat a lot of chicken. Maybe, you know, they might say turkey or something. Is they're kind of thinking, what do you mean when I say healthy? I'm not sure. They mean a lot. Usually they get the idea they should eat a lot of protein. But basically I ask about like, well, what about vegetables? Oh, no, we don't. Does French fries count? We don't really eat vegetables. And I think that if you could just summarize a healthy diet down to just a couple sentences, it would be eating fruits and vegetables and reducing or reduced amounts of ultra processed foods. So if you take those ultra processed foods that come in a package, with plastic and writing on the outside of the package, those things are really not good for us. We have, it decreases your lifespan, the more servings of ultra processed food per day you eat. And so whole foods, home cooked foods, and fruits and vegetables are the most important short interventions you could say to help improve people's diets. Exercise, everyone knows, moving more is good for you, but it also just improves your mood. If we just got up and danced for 5 minutes, we would feel a lot better sitting back down. So not moving is not good for your mood, and anybody that you can encourage to move more, it's a good thing. Sleep is another one. These are kind of like the pillars of lifestyle medicine. They talk about diet, they talk about exercise, they talk about sleep, making sure you get restful sleep and enough sleep. It's almost like you just can't be at your best if you haven't gotten a good night's sleep. And we all, if you've ever had young children that wake you up in the night, you know, you just can't function nearly as well if you haven't had a decent night's sleep. And so that's an important thing to work on. Environmental exposures like toxic things like smoking and alcohol, but also things in your environment like excessive plastics or lead or mercury. And then mental health habits, techniques, and social connection. Those are all important for lifestyle of happiness. Social relations has actually been separated out as a whole separate category now. So there's 6 pillars now for lifestyle medicine. Exercise. You know, people are not moving as much as they used to. Today's youth are moving less than any other cohort of people ever in the history of the world. I don't think that study has ever been run before of people moving as little as they do now. The only people who are close to the young people now are their parents, because that was previously the least or the least active generation. Now we're even less active. And I don't know what's going to happen with their bones and their, you know, whether they're going to have osteoporosis or their range of motion or whatever. But a person who stays active throughout their life has a much better chance of having, you know, more mobility and function in their older years. This is a picture of 2 older ladies who went kayaking with a group with us, and they still pulled their kayaks up the hill even though they were 75 years old. And just staying active is super important for for your mental health and for your happiness. Both cardiac fitness, stretching, and strength training are all good. Diet, again, like I just said, fruits, vegetables, all that stuff's good for you. You know that there's more to healthy food than what you can get in supplements. There are many different phytonutrients, and when they give you a supplement, they're selecting out one or two things that come from whole foods, but it doesn't have the fiber, it doesn't have all the other things that are in there. And just like Marinol is a selected chemical compound from marijuana, but it doesn't have nearly the same effect on people as marijuana does, because marijuana has all these, an array of terpenes and other phytochemicals that are not present in just Marinol. Pretty much everybody dislikes Marinol, and a lot of people like marijuana. It's a completely different thing. So supplements can be helpful if you're restricted in your diet, like those prisoners I mentioned, but fruits and vegetables are just not replaceable in general. All right, so we're going to talk a little bit about some techniques that I think are evidence-based. This one is journaling. Journaling, like when we were kids, maybe we had a diary, or people in the past have kept a diary, a daily log of what's happened. And it's something that we think is sort of like a childish thing, but that Duke did a study where they had people write down 3 good things that happened to them every day. So it might have been something that touched them, or something, a success, or just a nice moment. And they found that just writing down those 3 good things for 4 weeks made people feel a lot better. That underlying feeling was just a lot more positive because of rehearsing those positive things. And after the 4-week study, a lot of people, like 75% of people, just kept doing it. And last year, when I was here at the lecture, John Mulder said he was doing that, and he felt that was very helpful. And he pointed out that the Duke website still has information about 3 good things and journaling, and you could sign up to do it for a period of time and record your results.
And a glass of bourbon.
And what?
And John said, and a glass of bourbon.
Yes, there are a lot of good things. That could be one of them.
Phytonutrients in that.
Yes, exactly. Yeah. Who knows what all's in that. So I think that kind of goes with gratefulness. When you're writing down good things, you're kind of gearing yourself towards the positive, instead of, like, if you could write down 3 bad things every night, 3 bad things that happened, or 3 things that were upsetting and made me feel bad, I bet that would decrease your general mood for the long term. So what you're doing is you're focusing on the positive and rehearsing those positive things. And being grateful is one of those places you can get to. Even if you're in a bad mood, you can usually be grateful for something. So even when you find yourselves in kind of a down place, if you don't know how to feel better, gratefulness is a good place to start. You can be grateful for, well, at least I have this, everything sucks, but at least I have this one good thing. I have this nice table, or I have my friends, or I still have this, or I still have that. And if you can just start listing the good things that you have in your life, it helps you get better and feel better. And so gratefulness is a good place to start if you find yourself in under a black cloud and or in murky waters. Prayers are another thing that's similar to mindfulness, or similar to meditation. And for a lot of people, they have a routine of doing a certain kind of prayers every day. Like, for example, praying the rosary. You can pray the rosary twice a day, and it has a very similar effect to meditation for the same amount of time, because you're focusing on, your internal connection and your centering and all that. And so if you have a tradition of praying, that's a very good thing for your mental health in general, and a calming ritual. Pretty much any calming ritual, maybe even the bourbon, but any calming ritual is good for you. Connection. So social connections are an important determinant of health, and they're even social connections or rich, positive social connections are even associated with heart health. That's one of the things that they teach you in the Pritkin centers or those places where they're trying to reverse cardiac disease, cardiac rehab. They talk about having people that you can rely on. In today's society, there are a lot less person-to-person friendships. Most people in the past would say they had at least one very close friend or two or three very close friends that they could tell anything to and be very close with. But now the most common answer to that question is zero. People have zero very close friends that they could tell anything to. And so it's a little bit more difficult these days with the way the social settings are running. It used to be that people would go to church every Sunday and they'd go to their friend's house on Tuesday for cards and they'd go to grandma's house for pie on Sunday and they'd, meet for coffee somewhere with this person and have dinner with that person. And so there were a lot more in-person social connections than there are now just built into people's lives. And some people just live really isolated lives. And you can't tell by looking. I don't know which one of you guys have a whole bunch of friends and which one of you don't talk to anyone and just go to work and come home and there's nobody there, Johann Hari wrote a really nice book about depression. And he said, an isolated human is like a bee without a hive. We tend to think of ourselves as just like a unit, I can go anywhere, I can move to a new city, I can work, whatever. But really having connections is very important for our mental health because our mental health is dependent on a lot of things that come from the primitive brain. The primitive brain, when we see that we are ejected from our group, like if you were in a tribal society and then you had to go all by yourself and they kicked you out, it would feel a lot like you were going to die, because being kicked out of a tribe puts you at risk because you're all by yourself. If anything happens, there's nobody to help you, and so being isolated increases your risk of depression quite a bit. Not everybody's lonely when they're isolated. Some people feel less lonely about it than others. Some people don't feel lonely at all. That loneliness is that sadness associated with solitude. Okay, I want to talk a little bit about kindness. Random acts of kindness is kind of a silly fad thing, I think. But the purpose of it is to point out to people how it makes you feel good when you extend some kindness or help to another person. So volunteering makes you feel good because you have been doing something to help others that doesn't necessarily benefit you, but it just makes you feel good. And that's one of the reasons why we went into these fields. This field that we're in is because we wanted to help other people. And not everybody has time to go volunteer at a soup kitchen or a lot of times you would like to help people, but you don't really see much opportunity for that, helping little old ladies across the street or whatever. So one of my patients who was previously a homeless man told me that you should carry a case of water in your car, water bottles. He said, every homeless person needs water. They're standing out there, they don't have water. So he said, he told the police this too. You should just carry a case of water in your cop car and give them out because you want to have a positive impact, but you don't want to do something that might have some negative consequences too as a side effect. So just doing some simple little thing like that is helpful. Also, being kind to others is helpful. If you say, well, I don't have time to volunteer, but I can point out that I really appreciate the things that are being helped, but not the way that I'm being helped. Like my scheduler who runs my schedule, I could say, wow, the schedule was perfect today. It was just, I had enough time to get from patient to patient to patient. Everything worked great. And I appreciate that. So just people that you're with who clean this room, who's picking up after you. If you have a chance to let people know, not in a generic way, but in a specific way, what you appreciate, or it makes you feel better and it spreads kindness a little bit into the world. And I feel like we do that as palliative care physicians, ideally, and hopefully we're always in a place where we notice others around us and others who are helping us and give them some feedback. Like I appreciate Joel being here today and helping set everything up. Because I wouldn't want to have to manage all that by myself. So that's, yeah, so I think kindness makes the world a lot better and it makes you feel better. Another thing that people find very fulfilling is working towards mastery on something, like, for example, playing guitar or singing or any kind of creative outlet particularly is very good for your mental health. Whether it's doing some kind of art or doing some, there's another picture of there, but I guess it doesn't matter. Doing some kind of art or creating something. I like making art and I like writing poetry. Pottery is nice too. I don't have a pottery studio.
Oh, no, I'm getting
Well,
way
we're going
ahead.
way ahead. Oh yeah, back. So do any of you guys here in the room have a creative outlet, something that you do that you used to do?
Myself,
So do you follow patterns?
I used to make my daughter's clothes. Wow. Yeah, I got that into it. I haven't done it many years, but I'm getting back into it as an outlet. Especially in fellowship, like just realizing that it's like more work, but something else to like different part of your brain.
Yeah, different part of your brain, like when you're studying, if you take a break and do something different, like play guitar or something, it feels really good. How about the rest of you? Any other creative outlets?
Why?
Live?
Yeah, an airplane. This doesn't work. And play the piano, sort of.
And play some piano? I think Dr. Rocco plays violin.
I'm impressed you remember that.
Yeah.
I used to.
Okay.
I used to.
Oh, we
I
could do what?
That'd be,
Oh,
It
wow.
would be,
At
it
the
could
end
be
of the
awful, but
fellowship,
just go upstairs.
graduation.
Dr. Emery, I'm really impressed you. Yeah, I want to pick it up again. The church where I go to, like, is kind of open to like all musicians of any level. No, I mean, seriously, I mean, like you could be.
Just learn.
I wanted to get my feet wet in fellowship, but I'd like to get back to it because it makes a difference. Yeah. Thank you.
That's a good thing.
Let's do it, Bruce.
Yeah.
Maybe at graduation, you guys could do a
We've got,
final.
instead of our project, we'll just do. Well, we're gonna get way off topic, but upstairs at Trillium Woods, there's a grand piano and there is at least one piano player that shows up there and does a decent job of going through his gig. I don't know how often, but I've talked to him and I thought, okay, I've got 3 pieces I'm working on at home and I'm horrible. I wouldn't dare do them today, but by the end of the fellowship, I want to do at least 1 or 2 of them.
Great.
Yeah,
So I'll share them with you or we
well,
can.
give us the dates.
You could come every week and play those 3 pieces. Yeah, that's great.
Nice. And they're good. The people and
Oh, yeah.
they're very good.
Yeah, they're decent.
Are they volunteers who come?
I think so.
Yeah.
I think one of them, his wife may have been here, but now he just comes and does that.
That's nice. He's beautifying the environment.
Yeah, and he
The music.
inspired me to sit down at the piano and
Mhm.
actually do something other than look at it.
Yeah, that's great. I heard this person saying you should put this into your head. Do it now, do it now, do it now, do it now. Because
Yeah.
a lot of times we think of
Oh.
things that we're gonna do.
The couch
We don't
is way
actually
too
do it.
easy.
It's, yeah, especially now with like scrolling on social
Yes.
media. And so they said that you should just stick this into your head. Do it now, do it now, do it now, do it now. So every time you think, oh, I should go do that, do it now.
Now with all the access to social media and inspiration, that you spend all your time on the inspiration side.
Uh-huh.
opposed to, you used to like maybe get a book on a hobby and then you had to go do it. Now you can just watch other people do it.
Or you could just buy the equipment off Amazon and then never actually use
It's
it.
like, let me just watch, like, let me like read up on it more, and it's like,
Mhm.
never start.
You never do.
Yeah, you never do. I know, seriously.
It's like canning. I bought.
Ask the gallery.
Well, it's still
Ask the
exciting.
others if they have an outlet.
Corwell Fellows and others on the, you want to get in on this
Yeah.
discussion, anybody? You have to unmute probably. Oh, they're moving.
Somebody plays.
Yeah, I
Oh,
talked to my son, my 15-year-old son about piano, because he's a high-level pianist about playing up here.
oh,
We're
wow.
gonna have a palliative care band.
Palliative care band. Wow, that would be great. Some of you might not be able to play an instrument, then you could just do interpretive dance.
Okay, so who's joining us?
I do that.
From Cornwall or others, this, creative outlet.
Mhm.
They're just waving.
They're waving, okay. I don't think they're speaking.
Yeah.
Oh,
Oh,
now,
yeah.
and
Quietly.
you turn the volume.
Okay. I put in the chat, I like to play piano. I used to make that an evening routine when the kids went to bed. I sadly don't do it every night anymore, but
Yeah,
it does definitely. Let me do.
it feels good.
Dueling songs, yes. do
Yeah,
that.
yeah. Marissa's asking for dueling palliative piano.
I
Okay,
like to do photography.
that would be fun.
Wow.
Yeah, that's one of my favorite venues.
Palliative
Dueling-
talent.
piano.
Dueling pianos?
Yeah,
Lauren was gonna say something.
it usually involved alcohol, but.
Who was gonna say something?
Oh, she just muted.
No, okay, we'll keep going then. Okay, so we're gonna talk a little bit about meditation. Meditation is an ancient practice and has been found useful by many, many generations and comes to us mostly from the Indian and Asian continents rather than Europe. And so it isn't really our tradition if we have a Western-based society, but it does have a lot of benefits to offer. It offers to balance the overactive sympathetic nervous system, which we have excess of in today's world. It slows your heart rate, slows your respiratory rate, and it can improve digestion and just make you feel less stressed. So all our modern diseases probably have a stress component and can benefit from meditation. Andrew Weil, who is a physician who is a alternative physician, you could say, he uses the term autonomic nervous system imbalance as his diagnosis and recommends meditation as his prescription for patients. It's a cost-effective tool, costs nothing really, for health promotion in general, and the effects are similar to the effects of exercise. It's often overlooked as an option, but it is very helpful. It decreases stress in a lot of different ways. I had to learn meditation because I had this patient who was a COPDer and she was on for 2 years and I had to keep going and seeing her for face-to-face visits and they kept impressing me, the family. The social worker said, "Oh, they're all so calm and so cool, and they're amazing." And they started telling me why they were amazing, and it was because of meditation. And so they eventually convinced me to learn transcendental meditation, which is the kind that they had been practicing. And I eventually got all my kids trained in it. And because I thought, well, this is going to improve their resilience going out in the world. And it really does do. And so you're focusing on your yourself, on your breathing, or on a single thought, and trying to exclude other thoughts. It reduces stress and anxiety, also reduces heart attacks, heart disease, and hypertension. It's good for treatment of addiction. It's good for treatment of PTSD, and it's good for depression. I know the transcendental meditation teachers give free classes to veterans because they're trying to help with PTSD. Meditation helps a lot with traumatic memories because, if you've ever heard of that book, The Body Keeps the Score, traumatic memories are often not processed like regular memories. Regular memories, you sort of rethink them a little bit and process them and tuck them away somewhere in your brain as a normal memory. But traumatic memories are too hot to handle and they just sit there like a clump and they're stuck in a sense. And meditation helps you because you can take a little bite out of it. Every time you're meditating, a little bit of it kind of comes up and gets processed. So eventually it gets processed. Psychedelics do something similar too. Well, they do it all in one shot where you get like psilocybin or DMT or some other experience that gets rid of all that stuff in one shot. But meditation does helps you work with traumatic experiences and memories gradually, little bit by little bit. You mostly are focusing on one thing and then something distracts you, a thought comes up and then you let it go. A thought comes up and you let it go. And that's the normal part of meditation because that's what you're doing there. You're processing all those little stress thoughts and letting them go. And if you follow what they recommend for transcendental meditation, they recommend 20 minutes twice a day. That sounds like a huge ask. You know, most people would want to start with 3 minutes once a day or something. But if you do 20 minutes twice a day, you find the first 20 minutes, 15 of that, you're just dealing with those little stress thoughts. And the last 5 is when all those stress thoughts are gone and you just get 5 minutes of joy. And then the second one in the day, you might only have 5 minutes of those stress thoughts and you get the rest is all just incredible feeling of joy and clarity. So you can see why they recommend it twice a day, and it twice a day helps. If you've got the more stress you've got going on in your life, the more meditation you need, really. The more quiet time you need. You know, if you're not going to do meditation, you at least need to have some quiet time where you aren't listening to a podcast, you're not watching a YouTube video, you're not absorbing television or something, where your brain has time to percolate, because we go from stressful situation to stressful situation to stressful situation all day. And you may be able to kind of lock those up for a while, but you will need to process those feelings. If you saw someone that reminds you of your sister, or you saw someone that reminds you of your mother, all these things that affect you are going to need to be processed. And you've got to have some quiet time, whether it's meditation, prayer, or just running. You got to have some quiet time every day to let things process. So let's do a little breathing exercise. Today, I want to teach you, this is the same thing that I did last year. It's called square breathing, and they teach it, the Navy SEALs teach it. It's a good way to calm down and center yourself. Can anybody tell me, what is your stress level right now on a 1 to 10 scale? What rating would you give it?
4.
4?
17.
4?
I have a 4-year-old. So.
Right, you're probably not getting good sleep. That definitely is hard. Okay, so if we just get in our mind what our stress level is, and then a number, and then we'll check after the breathing exercise to see if it's gone down. So here we're going to do it together. We're going to breathe in 1, 2, 3, hold 1, 2, 3. You don't have to close your glottis, just hold, and then out 1, 2, 3, hold 1, 2, 3. You see the square? In 1, 2, 3, hold 1, 2, 3, out 1, 2, 3, hold 1, 2, 3. In 1, 2, 3, hold 1, 2, 3, out 1, 2, 3, hold 1, 2, 3. In 1, 2, 3, hold 1, 2, 3, out 1, 2, 3, hold 1, 2, 3. One more time. In 1, 2, 3, hold 1, 2, 3, out 1, 2, 3, hold 1, 2. Okay. Now feel how your body feels. Now let's think. Give us a rating of your stress level now.
3.5.
Is it any better? Yours a little better? Yours? You didn't do it. Dave's went down by 2. Okay, good. That's good. So this is just a basic relaxation response. It's a reflex that our body, it knows how to do. It's basically to go from the sympathetic system to turn on the parasympathetic system and to go back to that rest and digest and safe kind of feeling. There's been some work recently about the called polyvagal theory, which is fun to read about, where they talk about ways, and there are little videos on YouTube of how to activate, the polyvagal, the parasympathetic nervous system again. One of the ways is tapping, which I'm not going to teach you right now, but you can all learn. It's a fun thing to do. It does reduce stress quite a bit right in the moment. Another kind of meditation that people can do is loving kindness meditation. And this is good for people who can't just sit and focus on one thought very well. You can start with this and learn how to meditate. You start out with saying something positive like, may I be happy today? May I be safe? May I be healthy, peaceful, and strong? May I feel loving kindness today? Then you say it about someone else. May my spouse be happy. May he be safe. May he be healthy, peaceful, and strong, and may he feel loving kindness today. And then you can add another person. You can do 3 or 4 people, and you might even do someone that you don't get along with that well, like someone at work that bugs you, and give them that. May they be happy. May they be safe. Maybe they peaceful, happy, and strong, and may they feel loving kindness today. And it gives you not only a positive expectation about your day, but it also makes you feel better about all the people around you because you have wished them a good day, and you have even wished a good day to someone who you don't really get along with that well. And so it just improves your general feeling of happiness. So this is another easy meditation to do. It's less difficult than the ones that require you holding on a single thought. Some things that are good for you, I guess, forest bathing, I guess I have seen studies where they took a bunch of people in Japan and they, who were depressed, and they had them walk, and walking is good, but they had them walking in the forest or walking on the urban streets. And they found about a 30% improvement comparatively for the people who walked in the forest, in nature, because there's all this stuff out there, whether it's the aromatics in the air from the smell of the trees. Maybe the trees, I've even heard it suggested that the trees are sending out calming chemicals so that you won't cut them down as you walk through. So, but yeah, there is a calming something about walking out in nature. So if you're going to be exercising, if you can exercise outdoors, hiking or biking outdoors is better than indoors. If you want another active thing to do, gardening is very good for you. Something about the soil, touching the soil is just extra good for you. And it also improves your access to whole foods. So this is my little garden baskets. I've got Concord grapes on the top and kale, and there's my little garden troll. They're helping. And pets are also a source of positive feelings, and just petting a dog or cat gives you oxytocin, and that's a good thing too for your mood. So it's hard to change what you do. It's hard to change your habits. I'd like us all to have a growth mindset, which means we might say, well, I'm just an anxious person, or I'm just this person or that person. But instead of saying that, always say to yourself, I haven't learned the skills yet to achieve this thing. There are a set of skills out there for anything I want to learn that I can find those skills and I can incorporate them, and then I'll be different. I'll do this. And so a growth mindset is a basic prerequisite for making changes and improving your life. I know I find I run up against that very often with patients. Like they'll say, well, this is just how I am, and I guess they've had an anti-growth mindset for a long time, and that's just where they're at. And so that's an important thing for us to have. And some things are simple, like they say, eat less, move more. It's simple, but it's not easy. It's not easy to achieve that or to change that. And so it's good to learn different ways of managing your own self. Like, how do I start? I want to be a runner. I want to run marathons. How do I start that? And it may be that you're gonna say, I am going to work on becoming a marathon runner, but for just today, I'm just gonna put on my sneakers and run in place in the house. Because that's all I have time for, that's all I have the bandwidth for. But then you can say, hey, I did that thing, and I'm gonna do that every day right after I brush my teeth, you know? And so if you work on it, you can create an action plan that can help you get into the habit. And once you're in a habit, you can improve the habit. So I recommend action plans for things that you're thinking about doing. Do it now, is a good way to get started on things. And then 30-day trials are good because a lot of times you might say, well, I don't think I can just do that, or I don't know if that would be good or how I would like that. But just say to yourself, well, I'll try it for 2 weeks or I'll try it for 30 days and see how it goes. Like I talked my husband into doing no dairy for 30 days because he was always complaining about arthritis pain. And I said, well, yeah, you have arthritis, but that doesn't mean you have to have pain. Like I see all these patients have these big knobby knuckles on their hands and they say, hey, you got arthritis. And they go, oh, do I? I said, does that hurt? No. Why doesn't it hurt? It's not inflamed. So inflammation is a separate thing from having some sign of arthritis. So in his case, he found out there was non-dairy ice cream and there was non-dairy cheese and there was non-dairy almond milk. And so he got through the 30 days and his complaints of arthritis, pain were down like 80%. And I was like, hey, so he kept on, you know, because the 30-day trial got him going on it. So sometimes with our patients, we're going to see them again in a certain period of time. And if you can talk to them about doing something positive that you want them to try just for a short period of time, just like our motivational interviewing that we learned, hopefully everybody learned now in med school or residency. You sometimes have to use those techniques on yourself. But yeah, that's how we want to do it. Toothbrushing is an example of something that people didn't do. Way back in ancient times, they had twigs and things to try and clean their teeth. But there was an actual toothbrush created in 1780 with boar bristles and a sheep tibia. And they started recommending toothbrushing as a hygienic thing, but it really didn't catch on until after World War I, when the soldiers got trench mouth, where they were just in those trenches eating crummy food and their teeth started falling out. So World War II, they made them brush their teeth twice a day. And when those GIs came home from World War II, they just kept doing it and they taught their families to do it. So it just caught on. And I think that's the same way with meditation. It's something that isn't really in our tradition, but it is kind of catching on a little bit as a positive thing. And hopefully more and more Americans will start doing it. So take heart. No matter what's wrong with you, there's more right with you than wrong with you. If you're alive, there's something to work with. That's from John Kabat-Zinn. He's a meditation guru, and he has several nice body scanning meditations online that he recommends for calming and for pain. Pain, alienation, and exhaustion are potentially fixable. I don't want my message to be that if you're in a bad situation, all you need to do is calm yourself down. Sometimes you're in a bad situation and you need to get out of it. You know, you're in a job that's crushing you or something is really bad, and that just making yourself happier isn't the answer to that. Sometimes you need to, you know, take your life and go. But you can, in general, you can get yourself into a happier place no matter what external situation you're in. And there's a whole world of calm, happiness, and inner capacity that's waiting to open up for you and for your patients. That's all I have to say. Any questions or comments? I know Dr. Bay, Simi Bay, likes lifestyle medicine, and she definitely talks to her palliative care patients about lifestyle interventions. She presented a CHF patient who she had a really good result with, a young guy. And so maybe she has another story. I don't know, but does anybody have any comments or questions?
You're very
I heard a little voice.
I heard a little kid.
We need the volume needs to go up on whoever is talking.
That might be a
I think it was a little voice,
little kid.
Yeah.
Yeah. Okay.
Simi, are you talking? Yeah, you're We can't hear you.
Yeah,
Oh, no.
no,
Where's our liberator?
no,
Need
all
some.
right.
Sorry, she said.
Okay,
Caught
she's
that.
saying, okay, well, I guess we'll wrap up then.
This is important. Thank you.
Oh, thank you for saying that. Yeah,
What are, like, we talked about the square breathing. I know
Yeah.
you mentioned tapping earlier. What
Yeah.
are some of your favorite ones to do with patients at the bedside?
the square breathing, I think, is the easiest thing that people are willing to learn. I had a patient with lymphoma who was on hospice and he didn't want to take, he was kind of a smart guy. He didn't want to take anxiety medication, which almost everybody takes anxiety medication when they're on hospice. And so he learned the square breathing technique and his family learned it and they would do it with him. And that was a great way to get him, off the edge and calmed back down. So that's a good, simple thing to do. The tapping, I have used tapping too for instant calming effect, and that's very powerful. But not everybody wants to learn that. Not all patients are open to that. But I think the breathing techniques, almost everybody's open to. You ready for switch to the case?
Yeah, we can go ahead and switch to the case. I believe it's Aaron today.
All right, thank you.
Thank you, Ellen.
Thank you.